السلام عليكم ورحمة الله وبركاته. النهاردة بإذن الله هناخد محاضرة Overview to Health Education. This lecture under supervision Prof. Dr. Nagwa Salem, Prof. Dr. in Community Health Nursing Department in Faculty of Nursing Mansoura University, and prepared by me, Rehabilitation, Demonstrator in Community Health Nursing Department in Mansoura University. The outline of lecture: first, concept of basic terminology related to health education, importance of health education, types of health education activity, objective of health education, stage of health education, example of content of health education, basic principles of health education, measure variables in behavior change, approach to health education, target for health education setting, who is responsible for health education, characteristics of health educator, finally, role of health educator. Introduction: health education is a profession focusing on the behaviors of systems and environments affecting health at a variety of levels. This profession requires intensive specialized training encompassing the biological, environmental, psychological, social, physical, and medical science. Basic concepts in health education. Health. The WHO defined health as a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. Physical health refers to anatomical integrity and physiological functioning of the body. Mental health, ability to learn and think clearly. A person with a good mental health is able to handle day-to-day events and obstacles, work towards important goals, and function effective in society. Social health, ability to make and maintain acceptable interactions with other people. Disease is the existence of some pathology or abnormality of the body which is capable of detection using accepted investigation method. Illness is the subjective state of a person who feels aware of not being well. Sickness is a state of social dysfunction, a role that an individual assumes when ill. Education, a complex and blended learning experiences that aims to bring about a change in a cognitive, knowledge, affective, attitude, belief, value, and psychomotor skills domain of the behavior. Information عبارة عن collections of useful, brief, or detailed ideas, process data, and series that can be used for a certain period of time. Communication, the process of sharing ideas, information, knowledge, and experience among people using different channels. Health education, it has been defined in many ways by different authors and experts. Lawrence Green defined it as a combination of learning experiences designed to facilitate volunteer action conducive to health. Importance of health education. Health education improves the health status of individual families and communities, states, and the nation. Health education enhances the quality of life for all people. Health education reduces premature death. By focusing on prevention, health education reduces the costs, both financial and human, that individuals, employees, families, insurance companies, medical facilities, communities, the state, and the nation would spend on medical treatment to promote and wisely use of available health service. The types of health education activity. Health education activity can be one of the following three. First, the primary prevention, secondary prevention, tertiary prevention. The primary prevention activities to change behavior to promote preventive action take prior to the onset of the disease or injury, at attending for immunization. Secondary prevention activities which focus on treatment or actions that block the progression of an injury or disease. The tertiary prevention activities to promote treatment related to rehabilitation. General objectives of health education. There is a general objectives of health education and a specific objective of health education. The general health refers to health promotion and disease prevention, early diagnosis and management, utilization of available health service. Specific objectives of health education: to increase knowledge of the factors that affect health, to encourage behavior which promotes and maintains health, to enlight support for public health measures and when necessary to brace for appropriate governmental action, to encourage appropriate use of health services, especially preventive service, to inform the public health medical advances, their uses and their limitation. Stages of health education: sensitization, publicity, education, attitude change, motivation and action, community transformation, social change. Example of health education. There is a proper health habits, nutrition education, personal preventive measure, safety rules, proper use of health service, mental health, sex education, special education such as incubation, mothers. Basic principles of health education. All health education should be need based، يعني تكون مبنية على احتياج. لازم تكون عندنا need علشان نعمل health education such as اللي هو health education about diet, exercise, personal hygiene. Health education aims at a change of behavior. It is necessary to have a free flow of communication. The health educator has to adjust his talk and action to suit the group for whom he has to give health education. The health educator should use terms that can be immediately understood. The health educator have to make themselves acceptable. Health education is based on scientific finding and current knowledge. Health education should provide an opportunity for the client to go through the stage of identification of problems, planning, implementation, and evaluation. It must be remembered that people are not absolutely without any information or idea. The health educator are not merely basing the information but also give an opportunity for the client to analyze fresh idea with old idea, or compare with past experience, and take decisions that are found favorable and beneficial. Learning by doing. If I hear, I forget. If I see, I remember. If I do, I know. Major variable in behavior change: knowledge, belief, attitude, value, skills. Knowledge عبارة عن intellectual acquaintance with facts, trust or principles gained by sight, experience or report. Belief, acceptance of or confidence in an alleged fact or body of facts as true or right without positive knowledge or proof. Perceived trust. Attitude عبارة عن manner or disposition, feeling or position toward a person or thing. Value idea, customs that arouse an emotional response for or against them. Skills the ability to do something well arising from talent, training or practice. Approaches to health education. The precision approach deliberate attempt to influence the other person to do what we want them to do. Directive approach. The informed decision-making approach, giving people information, problem-solving, and decision-making skills to make decisions, but leaving the actual choice to the people. Target for health education: individuals, groups, or community. Individuals such as client of service, patient to health individual. Groups such as groups of students in the class, Ulyas club, مركز الشباب. Community such as people living in a village. health education setting: السيتنج اللي ممكن نعطي فيها health education. communities and homes, healthcare facilities, work sites, schools and university. persons. health education process: the health education process consists of first assessment and planning, implementation, evaluation, and communication. Assessment is the appraisal of individual and the community needs for health education in order to determine health knowledge or perception, attitudes, motivation, and practice. Priority area, nurture and emphasize needs for health education based on result of collected data. Appropriate health education activities for the design target population. The assessment process includes the selection of valid sources of information about health need, utilize existing computer resources, database, or other appropriate data gathering instrument. Second, planning. It is a comprehensive approach for preparing and developing effective health education that begins by establishing content of health education which is complete, accurate, updated, valid, and concise. Establishing specific behavior goals and learning objectives which are realistic, observable, and measurable. Selection of educational method and strategy appropriate to target population. Selection of educational media which are clear, attractive, and simple. The third step, implementation. In the execution of the planned health education, in which the implementer will deliver a series of planned learning activities designed to achieve change in the health awareness, knowledge, attitude, skills, and behavior. These activities involve setting up, managing, and executing instructional session, method, strategies, wellness activities, intervention, and promotion measures that address objectives. The four steps, evaluation. In the process to determine the effectiveness of health education and whether the objectives were met and required the collection and examination of appropriate data. It documents the strengths and weakness of health education planning and execution and monitor participant performance. Finally, communication is the sharing of health education need, concerns, and resources with the target population and program stakeholders, persons, or groups that interested in the success of the program. Communication should include increasing awareness, illustrating skills, reinforcing knowledge, affecting attitude and behavior change, supporting risk reduction and disease prevention, risk reduction and disease prevention, health policies, and reporting program effectiveness. Who is responsible for health education? مين هو المسؤول for health education? Health education is the duty for everyone engaged in health and community development activities. Health extension workers are primarily responsible in working with families, communities to promote health and prevent disease through the provision of health education. If health and other workers are not practicing health education in their daily work, they are not doing their job correctly. Characteristics of health educator. Introducing direction on the basis of knowledgeable opinion, sending a clear message to the learners, selecting the most appropriate learning format, creating the best possible environment, organizing positive and meaningful learning experiences, engaging the learner in participatory learning, evaluating and giving objective feedback to the learners, personality personality تكون popular, influential and interested in work, efficiency, trained and prepared for the job, must show good examples. Role of health educator. Assessment. The first assessment, talking to the people and listening for their problems, thinking of the behavior or actions that could cause, cure, and prevent the problems, finding reasons for persons' behaviors, helping people to see the reasons for their actions and health problems, planning, asking people to give their own ideas for solving the problems, helping people to look at their ideas so that they could see which were the most useful and the simplest to put into practice. Implementation, encouraging people to choose the idea best suited to their circumstance. Communicating health and health education need, concerns and resources with people. Evaluation, documenting the strengths and weakness of health educating, planning, monitoring people performance. شكرا.